The final day of the inquest into the death of Maeve Boothby-O'Neill was conducted on Friday, and the aim of that day of the inquest was to try and learn from her case how future preventable deaths from ME could be avoided. We're joined now by Karen Hargrave, who is the co-founder of There for ME, which is a campaign calling for an NHS that's there for people with ME and long COVID. Thanks for joining me, Karen. So the first thing I wanted to ask you is, why is it that Maeve Boothby-O'Neill's death is considered to be such a landmark case within the community of people who are affected by ME?
Well, I think there's a couple of things that are quite unique about Maeve's case. You know, Maeve isn't the first person with ME to die in the UK, or the first person to have ME on their death certificate, but a couple of things have been very unique, one of which I think is the level of media attention that we've seen to the inquest. I think in general there's often a lack of understanding, I think, generally in across society about ME. A lot of people who don't really understand what it is, that it can be this severe. In this case, it's got a lot of coverage in the media. And, you know, as someone with ME myself, as someone who cares for someone with ME, I've had lots of people coming up to me, saying for the first time, I saw this in the news. I didn't realise that ME could be this serious. I didn't realise that people could die as a result of complications. So I think it's really triggered a kind of conversation. And there was something that was very significant yesterday in the inquest around Maeve's death, which was that the coroner has basically said that they'll be issuing a prevention of future deaths report. And that's very significant because that's the first time that that's happened for someone with ME. And effectively what that means is that from the evidence that she heard about Maeve's death and her treatment leading up to her death, the coroner felt that there was, significant learning that could be taken on board to prevent future deaths of people with ME. So I think, that's feels like a very landmark, significant moment. And I think it's really something to build on.
And that was going to be the next thing I was going to ask you about, because I saw that the coroner said that they hoped lessons would be learned and that future deaths could be prevented. What specific lessons do you think it's most important that particularly medical professionals learn in terms of caring for people with ME?
Well, I think there's lots of things that we heard through the inquest that were really quite concerning. I think a lot of this wasn't new for people with ME, but it's now sort of part of the public record and public debate around it. We heard yesterday that there's not a single specialist bed anywhere in the country for patients with severe ME. We learned that there's no specialist pathway for people who are severely affected. And actually, there are very, very few clinicians in the NHS with enough knowledge and understanding of ME to be able to provide people with ME safe and appropriate care. And I think what is, particularly concerning from what we've heard in the last few days and really quite extraordinary is that we've sort of heard in the media that there's some kind of acknowledgement of some of those gaps sort of at a high level from NHS leadership, but that also there's no current plan to do anything about it. There's no plans to commission specialist services for patients with severe ME. So we're really, I think there's a lot that needs to change. The first thing, the bottom line is that I think people with ME are entitled to safe care from the NHS. And, what that means is that people with ME should not be getting worse as a result of NHS care, which unfortunately we're seeing too often. And I think we're seeing in some instances in Maeve's case. And, it also means that the NHS should be saving people's lives with ME when it's needed. Just like any other patient, people with ME are entitled to safe care from the NHS. And I think what we've seen from Maeve's case is that there's a lot of gaps, which mean that there aren't structures in place to be guaranteeing and delivering safe care.
And I know that the coroner did say that they couldn't find any evidence that any of the people who had cared for Maeve didn't think that ME was a real illness. But I've also read some comments from Maeve's parents talking about the dangers of conflating ME with mental health issues and how that does a disservice to both communities, both people affected by ME and people affected by mental health issues. In your experience and from speaking to others who are affected by ME, is it still something that happens where medical professionals believe that ME is psychosomatic?
Yeah, I mean, I think absolutely. That's been a very, very dominant idea for a very, very long time. And I think, I think the science and the research has moved on from that now. And I think actually the public debate has also moved it on, because we've had a lot of media coverage of Maeve's inquest. And I don't think I've seen any media outlet, seriously questioning that this is a biomedical real disease. Not to say as well, not to say that mental illness isn't a real disease as well, but that this disease is not psychosomatic. But unfortunately, that's been the sort of dominant view for a very, very long time. And there's sort of a generation of healthcare workers who've been sort of trained under that model. And I think we're starting to see a shift in attitudes, in healthcare across society. But obviously it takes a very, very long time for that to filter down into clinical practice. So, I've heard a huge number of stories from people who've been dismissed in interactions with healthcare, who feel they haven't been taken seriously, who've been told, I've been told myself when I first saw a doctor for my ME symptoms, I was told, oh, well, maybe you're just a bit depressed. Maybe you need to get out for a walk to the shops. And those kind of encounters, they can be very, very damaging and very traumatic. I found there's a trauma that I've had myself from my encounters with healthcare. I sort of recently, I saw a doctor for a wrist injury, and I'd gone for a scan, and I was sitting in the waiting room waiting to see the doctor. And I just caught myself, and just what was going round and round my head was thinking, what if what if nothing has come up in the scan? What if the doctor says it's all in my head? What if he says I'm making it up? Like, what if there's nothing wrong with me? And of course, I went into the appointment and he said, yes, you've got a torn ligament in your wrist. That's what's wrong with you. But I think that was a recent moment when I realized how deeply some of those experiences had affected me. And pretty much every person with ME I've ever spoken to has some kind of experience like that to share. And there's a lot of pain and there's a lot of trauma. And, there are healthcare workers out there who are very empathetic and who are trying their best in a system that isn't supporting them. We had last week, we had a letter that was coordinated by our campaign that was signed by 280 healthcare workers expressing concern about the safety of patients with ME in the NHS. There are healthcare workers out there who get it, who are on our side and who are trying their best. But it does take a long time for attitudes to change and for that to filter down into clinical practice.
And ultimately, I suppose what we're looking for is a consistency of care. And I did see that on Friday, the Times reported that NHS bosses were rejecting calls for specialist ME care. But hopefully these calls from the coroner will make them reconsider. Thank you so much. That was Karen Hargrave, co-founder of There For Me, a campaign calling for an NHS that's there for people with ME and long COVID.